And you're very welcome back to Northwest Today. Coming up in a short while on the programme, we're going to be speaking to a Donegal student who has been shortlisted for a competition to highlight responsible drinking, and also we'll be finding out about a course for people who are actively looking for work, which is being offered in Ballyshannon in April. But just before that, we are joined in studio by Gabriel McSharry, our medical herbalist and a nutritionist. Good morning, Gabriel.
Good morning, Margaret.
And of course, if you have questions, you can send them in to us now to 083 3500 530, which is our text. And you can call us at 0818 365 500. Now, this person says that they have blood pressure. They're on tablets to control it, but they still get headaches. Would they be related or not?
Yes. Well, headaches is one of the symptoms of hypertension, which is high blood pressure. And it's one of the reasons one might look for if someone presents with headaches on an ongoing basis, or blurred vision, or stuff like that, or irritability. It's, it could be there's a lot of pressure in the system. Possibly it's not being controlled with the medication, and maybe they need to readdress it with their GP, or there's certain herbal medicines that can be used in conjunction with the pharmaceuticals that can also be of benefit. What they could do is keep an eye on it themselves. Years ago, the cuff that you test your blood pressure was it was an expensive piece of equipment, but now you can get them for they're not overly expensive, and if someone has quite ongoing hypertension, I'd recommend that they get one themselves, one for their arm as opposed to their wrist, and keep an eye on it themselves, because even with the medications and so on, it can still be unstable and worsen over time.
And is this like a digital thing that you put on your arm and it checks it for you? Yeah,
I can't remember maybe a Tanita is the make one I have, but there's many makes, and it's just the technology has come on now where they're very good, and in fact they're used in hospitals, and a lot of GPs are using them now as opposed to the mercury blood pressure machine, and they can be quite good just to check. Obviously, there is a chance it could need to be recalibrated, and it could give a wrong. But if you're getting really outrageous readings, check with someone, a GP, or I always take blood pressure, or do it in chemists now. It should be around 120/80. So the systolic is the top one, 120. Diastolic should be around 80.
And which of those would be worse for you if the high?
It's an interesting question, because I was always saying that it's one of them. If it was the bottom one that was high, then that's worse than the other one. But now the medical opinion on it is that's not true. It's much maybe both of them are important, or as important, because both of them tell you a different thing about the mechanism of the heart. Hypertension or high blood pressure is classified as anything above 140/90. So if your readings are above there, and it needs to be taken on a number of occasions, you can't just on a snapshot, if someone comes in and they're above that, I can't diagnose them with hypertension. You'd need to do it on another time, because
I'm sure even the stress of going to GP, or even someone like yourself, could raise your blood pressure. You might have having a nightmare morning or something like that,
or you're in a traffic jam, or you had something for breakfast that you're allergic to. So allergies can also put up blood pressure, and it's well documented. It's called white coat hypertension, where your blood pressure is generally stable, but when you go to the doctor, it flies up because you're nervous. Because
you're nervous, yeah. Because take, for example, you're someone who's afraid of maybe getting an injection or having blood taken, then you're thinking automatically, when I go through this door, he's going to bring out a needle.
That's right.
That can put it up.
Yeah, as well. Look, it's well documented in scientific literature, and GPs are aware of this now, so they don't. I think what's common now is a 24-hour blood pressure monitor. So if after more than one occasions the blood pressure seem to be high, they may recommend, if they think that it could be white coat hypertension, so it's just going up while they're in the surgery or whatever, then they can get a thing called a 24-hour blood pressure monitor, and I think you get it from the hospital, but basically it's a monitor you put on and you leave on for a 24-hour period. So even when you're in bed, it comes
read it
on.
for you.
Yeah, it puts the pressure, it reads it. And what to do then is after the 24 hours or whenever you return it to the clinic, to download all the measurements and to take an average. And that gives a better, more precise insight into what your blood pressure really is.
Are we back to diet again as well? Where blood pressure?
Definitely, yeah. So a couple of obvious, well, maybe not so obvious things. That watch stimulants always should be avoided in people with hypertension, but stimulants are caffeinated beverages, so that's coffee, tea, Coke, dark chocolate, and there's certain other stimulants, like you get them now in the sports drinks and stuff, or other drinks like these Red Bulls and things which use certain herbs like guarana, some of the ginsengs. And I'd watch all these too. High sugar intake is stimulating alcohol. But definitely.
What about what's on the dinner plate?
Yeah, good question. So, I mean, in general, heart health is what you're looking at here. So blood pressure is a risk factor. Heart health is defined by maybe 7 to 10 risk factors, and by all means you should focus on all these risk factors and not so much look at any of them in isolation, but they're this sedentary lifestyle. So if you have a sedentary lifestyle, it's a risk factor for heart disease. Hip to waist ratio. So again, probably the body mass index, more accurate is the hip to waist ratio, but what it really is your weight. So normalise your weight, get your BMI into between 18 and 25. Use a BMI calculator you get on the internet, measure your height and your weight and stick it in. Blood sugar levels should be stable and should be normal. Blood lipid levels, so these are triglycerides and cholesterol. Hypertension, so blood pressure, everyone should be normotensive, and I gave you the ranges earlier on. Familial history, so if you've had people in the family who've had heart disease, it increases your chances of having. Doesn't mean that you're going to, but it's just a risk factor that one takes into account. And there's other things now that there's a few more being added all the time. CRP, it's a C-reactive protein, is a marker of inflammation in the body. Homocysteine and so on, a lot of blood markers. But in general, how many of these can we control? Quite a lot of them. We can make sure we exercise, and the exercise you need to lower blood pressure, stabilize blood pressure, isn't a massive amount. You don't need to kill yourself in the gym. In trials, it's something like a 5 to 10 minute walk, brisk walk on a daily basis. Look, we can all do that. Surely we can fit it in maybe at lunch break or something. But I like to recommend 30 or 60 minute walk a day if possible. Now, obviously, it's not going to be possible every day, but really we should try. Yeah. So that kind of covers the sedentary lifestyle thing. The diet, as I say, watch the stimulants. Also, diet comes into play when we're looking at blood glucose levels, weight, blood lipid levels, and many of the other risk factors. We can't change our genes, so familial history we can't change, but it's important to know this now. For years now, we always thought that we had this predisposition because of our genes. I can do nothing about my health, it's in me genes, I can't change them. This is the wrong opinion now. We know this, that just because it's a predisposition doesn't mean it's a predetermination. So it's the expression of the genes. So genes turn on and off, and what turns them on and off is our environment. So our diet, our lifestyle, our thoughts, our emotions, our mind, how we respond to our environment. expresses our genes. So even if there's a lot of cardiovascular disease in our family history, it means you have a predisposition, but it doesn't mean that you're going to develop heart disease. You can turn it around.
You can turn it around yourself. Okay, this listener says that what can be done for a frozen shoulder? They're diabetic and had injections, but no good. My surgeon has told me I have to have surgery. What do you think?
Well, I mean, if the orthopaedic surgeon says that they have to have surgery, there's possibly degenerative disease there in the joint, osteoarthritis, calcification, or otherwise. And sometimes there's nothing. There's definitely nutritional aids that can help and herbal aids that can help with pain and so on. But with regards to reversing a joint, if it's, for instance, well, I know this is the shoulder, but the shoulder is a ball and socket joint, so it's a ball that sits into a socket. But if you can imagine that half the ball was gone just from wear and tear over many, many years, as far as I know, you can't regenerate that. And if the surgeon recommends that you need a new shoulder, then it's probably down to severe degeneration of the joint. However, people can live many, many happy years with a joint that's not fully
functional.
But you want to look at quality of life, pain, functionality, mobility. If it's a frozen shoulder, I mean, we need both arms. If we have them, it's great to have full functionality. So I'm not too sure, but definitely with diabetes, it's very, very important to control diabetes, and diet is massive here, especially if it's non-insulin dependent diabetes. So type 2, which is very, very common these days, there's some really brilliant dietary recommendations that I recommend that really improve a lot of the factors for people with diabetes. They can be controlled with medication, but it's diet and lifestyle is a big thing, and type 2 diabetes can be reversed. And but it's important to keep that stable, and that'll help the healthier joints as well.
Okay, this listener is taking Active 55, which contains cod liver oil. Is it true that cod liver oil is bad for cholesterol?
That's untrue. And a note on cod liver oil. Cod liver oil has been taken for 60, 70 years. It's I don't see it as a supplement. I like to think of it as a superfood, an extract of a food. However, it has changed over the years, and I think it was something like 13 years ago, vitamin A in high dose is seen to be iatrogenic, so it can have birth defects for people taking it, and it's only synthetic vitamin A, so foods containing it's not been seen. So but because of that, everything that has vitamin A in it, all the supplement industry and so on, they have to titrate it to certain doses. So you can say there's a certain amount of vitamin A in that pill, and that's okay. But so cod liver oil contains natural vitamin A and vitamin D, so therefore how to do it now is they take the oil from the fish, they filter out the vitamin A and D, and add it back in titrated doses, so they can say there's so much in there, and that's okay. But in order to speed up the process in line when they're making it, they add in synthetic vitamins back in, so synthetic vitamin A, synthetic vitamin D. So in my opinion, cod liver oil has come down as a superfood in recent years. Now there is 3 companies, I think, or maybe 4, who do produce cod liver oil, and they put the natural vitamins back in, and they're mainly Nordic countries or companies, but there's a few based in the States. Nordic Naturals is one that comes to mind. That they have a really high quality one. Now the Active 55, I think they're throwing vitamins in there as well, other stuff. But anyway, back to the question, would it have a negative effect on blood lipids? No.
Okay. Now, this listener suffers from hay fever, taking Lusa for it, a herbal remedy, a tincture tablet. Is that any good, or would you recommend something else?
I haven't heard of Lusa, but it could be
LUSSA is what it says here.
Yeah, it's probably a trade name for, it's not the name of a herb. I don't think so anyway, but it's probably a trade name. Hay fever is something that's quite topical right now. I mean, it's seasonal, and just to give you it's usually not necessarily related to hay, and it's not associated with a fever. But the term is used to describe the seasonal suffering of patients who are allergic to pollens, so trees, weeds and grasses, and different plants pollinate at different times of the year. So there's a spring, summer and autumn sensitivity, and geographical location will often dictate when the patient would develop the symptoms. So the symptoms are the main symptoms are this, like itchiness, so eyes, nose, roof of the mouth, throat, sneezing, nasal discharge, nose is swollen, conjunctivitis, so affects the eyes, nasal obstruction, possibly development of nasal polyps, headaches, irritability, depression, and it may exacerbate existing disease like asthma and so on. So with the herbal treatment, by far the kingpin that I use, the front line at the clinic, is a number of herbs. There's 5 herbs, and these are clinically proven, and they're used actually for 7 decades. This formula has been used, and it's been prescribed to millions of people globally for then. But as I said, there's a good bit of scientific literature on it, and the herbs are Gentiana lutea, or gentian, primula versa, or primrose, rumex crispus, so sorrel, sambucus niagara, elderflower, and verbena, or vervain. These are the 5 in a certain amount of ratio, but it's been clinically proven and effective for sinus pain, upper respiratory tract infections and headache, blocked nose, pressure over the sinuses, everything to do with kind of hay fever. It's good for. So I mean, if Lusa is the trade name for a number of herbs, we'll look and see do they correlate with that. But that's, in my opinion, the best, and I've used it clinically for years, and it works very, very well.
Okay, now we've a lot of questions in, so what we're going to do is we'll hold them over, and we'll deal with the ones, and we're sorry we just don't have time to get them all, but we'll deal with them next week. Gabriel McSharry, medical herbalist and nutritionist, thanks for joining us on the programme this morning. Of course, you're back with us again next week just after 10 o'clock. Rejoin us just after this break.
Ocean FM.